Nursing students, never mix this up again. One is a disease, the other is an infection. Come closer. Let me simplify COPD versus pneumonia for you. I have NCLEX review of COPD and pneumonia on my YouTube channel at Scrub and Spoon. Go review that. Now let's go. Now let's talk about COPD first. COPD meaning chronic obstructive pulmonary disease, right? COPD is a long-term lungs disease that makes it hard to breathe. Why? Because two things. The airway are swollen and full of mucus, and that is what is referred to as chronic bronchitis. And two, because the tiny hair sac in the lung, which is the alveoli, are damaged and can't work properly, which is referred to as emphysema. So think about COPD as an umbrella that contains chronic bronchitis and emphysema. Okay? Now, causes/risk factor of COPD. This particular one is always NCLEX worthy. Of all the causes or risk factor for COPD, the major one is smoking, okay, and also long-term exposure to irritants like dust, like chemicals, like air pollution. Now, signs and symptoms a patient will experience will be chronic productive cough. That is, when they are coughing, they are spitting out phlegms, sputums, like yellow, green, rust sputums, right? Shortness of breath, especially on exertion. That is, they get shortness of breath with increased activities. Wheezing, fatigue, barrel chest. Let me explain to you barrel chest. Remember, like I said, emphysema is when the tiny hair sac in the lungs is damaged, right? So during gas exchange, the inhalation and exhalation, it is easy for patient that has COPD to inhale air, right? But it's very difficult for them to exhale the air. So since it's difficult for them to exhale all the air that was inhaled, now some air are trapped in the alveoli, the tiny hair sac in the lung, and the more hair gets trapped in the alveoli, the chest begin to expand, and that's when you see the barrel chest, right? And tripod positioning. Tripod positioning is when patients with COPD are sitting upright and either put their hand on the table or on their laps to expand the lungs and allow easy oxygenation and allow those trapped air get out of the lungs. Clubbing of fingers. You see clubbing of fingers. And last thing, false lip breathing. You will see all of these in patients with COPD. Now, what are the treatment options? First thing is oxygenation, low oxygen. Remember, do not increase or give them high flow oxygen because it can actually suppress their respiration and make it even difficult for them to breathe. So it's always low oxygen. Now, next one, bronchodilators. What are bronchodilators? They are used to open the airway, like albuterol. Albuterol is rescue inhaler, and it opens the airway in minutes. So that is very good for them. And the next one is ipratropium. It has anticholinergic effect. And remember, the mnemonics for anticholinergics: can see, can spit, can pee, can poo. So it dries out the body. So this helps to dry out the mucus in the airway and also opens the airway. Inhale steroid like fluticasone. Okay. Oral steroids for exacerbation like prednisone. Encourage them to stop smoking because that's the cause. And also small frequent meals because eating actually consumes energy. So you want to give them small frequent meals and they are able to breathe. Okay. Remember this NCLEX tip. Nursing diagnosis for COPD is impaired gas exchange. Now let's move to pneumonia. Now, pneumonia is an acute infection of the lungs that causes inflammation and fluid build up in the alveoli, making gas exchange difficult. And you need to know that pneumonia can be either bacteria, because it's an infection. It could be either bacterial infection, viral infection, it could be fungal, and the last one, the most popular one in the hospital, aspiration pneumonia, NCLEX tip. And aspiration pneumonia means aspiration of food, like food going into the lungs, fluid going into the lungs. That is aspiration pneumonia, and it's always common. It's always hospital acquired pneumonia is aspiration pneumonia. NCLEX. Now, the signs and symptoms a patient will feel if they have pneumonia: fever and chills, productive cough like yellow sputum, green sputum, or red or rust color sputum, shortness of breath, crackles, increased heart rate, fatigue, malaise. Okay, now to determine the treatment option for pneumonia, you need to know what type of pneumonia they have. So as a nurse, you have to obtain sputum culture for the lab to test it to know what type of pneumonia they have, and that will determine the treatment. So if it's bacterial pneumonia, they'll put them on antibiotic. If it's viral pneumonia, they'll put on antiviral, right? Now you give them oxygen to maintain saturation of greater than 92%. Okay, intensive spirometer helps them to open the lungs, right? Every 1 to 2 hours they blow air into the intensive spirometer, and it helps the lung to open. Encourage hydration, because giving them fluids help to thin the mucus, and it helps them to cough it out. So hydration. Also monitor lung sounds and be ready to suction out any secretion in case they are unable to cough them out. Okay, some NCLEX tip is that for pneumonia, you need to use either droplets or standard precaution depending on the pathogen, okay? And monitor for signs of sepsis like low blood pressure, high heart rate, fever. And the last one is always raise the head of the bed up to promote oxygenation and prevent aspiration. Especially the most common hospital-acquired pneumonia is aspiration pneumonia, because they can get aspiration during feeding, and that's why during feeding the head of the bed have to be on high foul. I have to be like 90 degrees sitting up. Okay, all right, I hope I have been able to differentiate COPD and pneumonia for you guys. Thank you.